Okay.
And we are now live.
Okay. So committee, this is Senate Appropriations, and we're continuing our work on the budget adjustment, which has been passed by the House and has been referred to us officially as of today. We had a couple of outstanding questions. One, we were going to do a rewrite of the language relative to the CRF money that would be available to the governor to use to address emergency needs, and to rewrite that using pretty much the language that we had used earlier on with the first 75 million of that COVID relief grant, and felt that we wanted to put a threshold in, but we didn't want to obligate joint fiscal to approve any expenditure of any amount, and therefore we're going to add $100,000 threshold, and just notification, and everything would move forward unless somebody objected. So I don't know, Stephanie, do you have that language for us to review now?
Jen and Steve worked on it this morning as well. And Chrissy, do you have the most recent one, or should I forward the one from Jen that I have?
If you could send the most recent, the one I had was from earlier this morning.
Okay, I have one at 12:19. So.
Yeah, I don't have that. That'd be great.
Okay, I'm going to forward it to Chrissy to put up on the screen, and for folks to forward it to folks as well. And I'll open it here online.
Okay, I'm opening it. Just got it. Thank you. Okay. Can everyone see that?
Yes.
Mm-hmm. Great.
So in sub A, it's the same $3 million. It moved the date out to May 15th, and it added to the extent these monies are available. And then in B, it sets up what I hope or what you wanted. So if it's under $100,000, the secretary can go forward and make the expenditure. If it's $100,000 or more, then she's required to inform JFC, and then any member of JSC can, within 24 hours, request that that proposal be held for full consideration by JFC. And number 2 sets out how that process of informing JFC and informing the rest of the General Assembly of the ask happens. And then if a member asks for an item to be held, then we weren't clear on how many days you were giving JFC to meet, to have that meeting to once the person says hold this item, what is the time frame by which JFC has to have a meeting to discuss and vote up or down on the item that's held?
I realize we've had 5 in the past, but I would say 3 days if we're talking about something related to public health, safety, or welfare.
Okay, and that's in number 3 on the next page, Chrissy, as you're scrolling. So we're going to put 3 days in there.
Madam Chair, before you leave that previous page, it says the member or the office or both shall also inform the other members of the Joint Fiscal Committee. I could see a cross signal there where the member thinks that the office is going to do it and the office thinks the member is going to do it.
It should be the office.
Well, it says they both shall, so
Or
they
both.
can't be assuming that the other's going to do it.
Well, it says or both. So there are 2 ors there. So there are 3 ways it could be done.
I guess.
Member or office or both. It just seems like that leaves a lot of room for.
Well, maybe we should have the member should, well, how do we normally, if you want it, we notify joint fiscal and then they
And then Teresa sends out,
And then Teresa sends it out. So maybe if a
The
member, I guess oh my gosh.
If it
Well,
said
I'm sorry, Kat. Come on, Twinkie.
the, if it
Um,
said the office, then I think it would work.
Well,
Mhm.
I think a member of joint fiscal has to notify the office, and the office will in turn inform the other members.
And so you do, the member who's making the hold up in the first says by directing a request to the Secretary of Administration through JFO within 24 hours. And so I think we could make it just the office in the second sentence.
That would be clearer.
And so it would be Teresa both informing the rest of JFC and the General Assembly.
Yes, okay. Does that take care of the?
Yes, that's great.
All right, great to have a English professor on the. 3 days, does that sound reasonable for this kind of expenditure? All right, come on,
Mhm.
come on.
well,
And then in A, B, and C, it's if JFC approves, it goes forward. If JFC does not approve it, disapproves it, then the option for the administration is to submit it to the General Assembly for consideration. And then the question in C was if JFC fails to meet within the time period or fails to act one way or the other, what do you want to happen? And yesterday I thought you wanted it to go forward if that happened.
We did. I thought we,
So we would make that clear. So if there's a hold, but JFC doesn't actually meet within 3 days, or if JFC meets and for some reason can't actually act, somehow isn't able to say yes or no, then the expenditure can go forward, and we'll make that clear.
I think yeah, I agree with that. If JFC doesn't meet or
Yep.
take no position, it goes forward.
And then number 3 just makes clear that if it's over $100,000 and no one asks for a hold, then the expenditure can go forward.
yeah. Mhm.
We should have to take an action if it's not going to go forward.
Okay. Any other comments? Are people in agreement with that? In other words, if we want to have this review and it falls into this category of use, it's got to be an obligation to act timely. And this specifies, that puts that obligation on us. And if we don't meet, then it will move forward. Or if we don't object, it moves forward.
Yeah.
Okay. So Stephanie, you all set on that?
Yes, well, that'll be that section will be fully replaced with what we just went through.
Okay.
It will be a strike all bill, just because we're adding the body cameras back. So you have a lot of sections that are moving, and it's easier to follow a strike all bill.
Okay. We also had the issue yesterday that we discussed around money for housing, rental assistance. And we had put in our bill 10 million. And then we got testimony that because of the cap 10% on a grant, that by limiting it to 10 million, it didn't give Vermont Housing sufficient funding to do the administrative work necessary to procure the IT system and put in place the really the requirements for this, for really a new program that has an income test when the old one did not. I've had further discussion. I actually talked with Secretary Young this morning, and they have prepared the AA1 because that grant isn't coming in under an existing department ID account, and would have to be accepted by through the joint fiscal process. Then we can put, with our acceptance, we can put parameters around, normally grants, the purpose of them is forward and we let the department move forward, but because of 200 million and the need to allocate across maybe rental and utility arrearages, our committees needed more time. And I had asked whether there was any flexibility on that administrative 10%. Could it be against the full grant as opposed to the grant to the Vermont Housing? And you saw the response and the answer was no. So, but Secretary Young said that that there is not, that it can be done. We've talked about moving forward on a separate bill. And from a timing perspective, that would work for them, rather than trying to jam something in budget adjustment when the economic development people have really not had a chance to give the necessary time in terms of how that grant money would look, what the parameters are, what administrative costs would be based on work done to date. So the administration has said, that it would be okay. They aren't instructing me, but they're saying because the 10 million doesn't work and our committees really didn't want to move forward with 50 million at this point, that this is something that could lend itself to another more smaller expedited fiscal bill to move some of that federal money out. There may be some other expenditures. What is this?
This is where you would strike this section. This would become a
Yes,
deleted section.
So what I would suggest is that because we have now gotten information from the secretary who has been in contact with Josh Hanford, that the timing on this is not what we thought was necessary, and because of the complications around the administrative cost, that we could take this out, strike it, and would be part of another funding bill that we would move separately, that has to be moved on quickly. Another area where they're still trying to refine the cost, and that was related to the UI breach, and what would be the estimated cost to do the financial monitoring for those households. And so that's another, that would give them time to really get their arms around what they think that estimated cost might be. They don't think it's going to be 7 million. That was something that was just rolled out quickly yesterday. So that would be something else we could put into a mini budget bill that we would move forward independently of the budget. So we would get the budget adjustment out, then we would move to this, we would put out this other smaller bill, and then ultimately we would move the big bill out as we go forth. So which is similar to what we did last year. If you remember, we had numerous CRF related bills. We had several for business grants. Oh yes, and that's the other thing, whether our committees are going to recommend some kind of business grants and what they might look like, what would be the parameters. The administration has proposed 10 million to go to businesses that I feel need help, but haven't qualified in the past. Knowing what the policies would be, the parameters around it, is something that our economic development people really need to get some testimony on. So that would be another potential area that, or component of this next bill. Yes, Bobby.
Yeah, I'm wondering too, if I'm glad we're waiting on this. Not that we don't need this money to get housing going, but there's a lot of unanswered questions. And when we allow an agency to take, 10% of 50 million, if we go that high eventually. $5 million is an awful lot of money for administrative work. And do we ever ask for an accounting or an estimate of how and why that there has to be that much money spent to administer a program?
Sure, all of this is subject to auditing, but as I mentioned, I talked to Senator Sorokin, and he had scheduled testimony to hear from the State Housing Authority for them to map out what the costs would be to set up this new program. The old one was easier because it didn't have an income test. This new federal money, people applying have to have income that's under 80% of the state's median income, and priority given to households with 50% or less median income. So that adds a lot of complexity to the program. The minute you have to start getting into household income and calculations and the data to collect that. So that's what economic development wants to hear. What would be the software cost, the staffing cost, et cetera, to set up that program. And this, by our not dealing with it here and pulling out that 10 million that we thought was helpful, which turned out to be so problematic, will allow the committee to get that kind of testimony.
Yeah, it seems as though I read over the weekend that in that legislative book we got from the National Council, did you guys look at the back part of that where it showed the median income and all the facts and figures? We're running about 64 million, if I remember right, as a medium household income in Vermont.
Not 64 million, 64,000 maybe?
64,000, yes. I was wishing, but I thought that they had some good facts and figures in that little magazine.
But what that means is then, and that of course depends, some of that. So by having to do a percentage of median income, that is something entirely new. So with a lot of explanation, I guess everybody is not unhappy that we can sort of let that 10 million, take it out and give us more time. We still have to get grant acceptance. And I think, Stephanie, could you just clarify that money, because it's coming down in the way that it is, it has to go through joint fiscal to be officially accepted. You're muted.
Yes, that's true. It either has to be accepted by joint fiscal or it has to be in a piece of legislation to be accepted.
Yeah, okay. And there seems to be confusion on that because some members have said, well, why do we have to go through joint fiscal? And it's because the way in which those revenues are coming into the state, and they're coming in a variety of ways. Some are going directly through existing accounts. So our transportation plan is budgeting because, and that doesn't have to go through joint fiscal. So it's a mixed bag depending on what the money is for and the extent to which it is to fund an existing program or an existing account with federal receipts. So that's how we're going to do it. And I just got a text from Suzanne Young saying that the AA1 has been submitted to joint fiscal today, will be today. Okay. So we will take that out and then we will take more time. We didn't do anything relative to the cost of the credit monitoring, but we don't have to try to firm that up today because we can put it on the list for this new bill. Yes, Rich.
So what would be the timeline when they could get started in moving?
Senator Sorokin's committee?
No, I'm talking about it, best case scenario, when would they begin to hand money out for rental assistance?
I don't have that information. That's something that we can try to find out. I don't know. We don't have anybody on economic development. But obviously the systems
Isn't-
work and writing the procedures and getting procurement and IT, it's going to take some time. So I don't know the answer to that, Rich.
The only thing I would say about all of this is people were caught up through the end of December. If now what we're looking at is April or May before anybody gets any help, 4 or 5 months is a long time.
Yeah. Well, I would think that knowing
Or
that
be
it's time
sooner.
sensitive, we ought to be able to finish up as long as we get recommendations back from our policy committees. This is something that we probably could move out. This committee's pretty fast. We could probably get it out in a couple weeks.
Yeah,
I'm I'm not opposed to taking it out or anything. I'm just saying if it takes us through all of our processes till the end of February, and then it takes them 6 weeks to get going, that's 4 months before they're gonna, and that's a long time for people.
And that's why I think our Economic Development Committee has got to move on it and give us their recommendations as soon as they possibly can. And I know that having Richard Williams in this week to testify is probably going to be a critical part of answering the very questions that you have.
Yep.
Okay. So the monitoring and the rental, we will not worry about now. The other parts, I think we're just trying to find out a little bit more. I think that there's, on the body cameras, people felt very strongly that we should buy the body cameras for the law enforcement employees of the state of Vermont. And somehow this got conflated with requirements with local police and requirements, and we need to straighten that out. And Senator Sears and I are going to see what we can do on that. So the earlier discussion
I
on
think
body
we're
cameras.
okay.
What?
I think we're okay on the purchase of the body cameras.
For not for municipals, or?
No, it was not for
No, Alice,
municipals.
no.
No, I know, I just want to make sure.
The
No,
Fish and
it's in the three
Wildlife,
departments, in the
What?
three departments,
Yeah, I
in
know.
the three
but some-
departments.
Yes, I get that, I get that. I thought you were talking about maybe doing it.
No,
Are
we
you
are
clear on the
absolutely
use-
not doing, we're not going beyond state
good.
employees.
Good,
We are only doing licensed law enforcement officers in the three departments of the state of Vermont. Although it does obviously raise connections to local law enforcement and what practices they have and whether procurement of equipment at some point, but this is not what this does.
right,
it's okay.
it's fine.
Right now, we do have you actually adding back the use of force, $402,000 as well.
I know, and
Well,
we
that may
need
be
to,
more problematic for the other body because evidently the chair of the Government Operations Committee over there may be the one that has the issues.
so I'm gonna,
I can check with her, but the body camera issue, I checked with the chair of House Judiciary, and she's okay with that as long as it's not taking money from something else.
okay, so we'll keep that and we'll hold until you can get a little bit more information, Dick.
Well, now I gotta write somebody else. I don't know how much we should be constrained by this constant trying to I don't understand why they don't want to spend the money on use of force training.
Well, if I could just
Yes,
add,
go ahead.
This has been a contentious issue. It was a contentious bill to get through. And we finally reached something that got all the way through. But what I worry about is if we don't put the 402,000 in, we're ceding that issue to them, because then it's just a fait accompli that they don't have the money to accomplish it according to the timeline in the bill that was signed into law. So I think the bill was signed into law. It requires it to be done by July 1st. We should put the money in. Then at least we're in a strong bargaining position at when we
So
go.
I'm going to suggest that we leave it in for now. Senator Sears
Yeah.
can have some follow-up discussion.
Well,
and we aren't going to,
it's the chair of government operations, not the chair of judiciary on that one.
okay.
Well,
And I can contact her, but are we gonna be ruled by House chairs?
well,
No,
I'm
I
saying
think we
no.
should be ruled by legislative intent, and we have a bill, and, if we need to, this is something the speaker and the pro tem can have discussion. But we passed a bill, it passed. And it calls for the training to be done by July 1st. The commissioner said that that training can be done by public safety and meet that deadline. But they would need to fund the wages for overtime. And so we are providing the funding to comply with legislative intent. So I think to redebate or relitigate or use this as a means to change the deadline is problematic. If they want to do it and we have the appropriation, then and it gets extended at some point in this session through another piece of legislation, the funding will simply go to when the training occurs. But I do think, as Senator Baruth and Senator Sears are talking about, this was, it went through the entire legislative process and it got passed into law. And what's being asked for here is consistent with the intent and the deadline in that law. And so I think what we're doing is saying we want to provide the funding so that legislative intent and the spirit of that law is met. And we'll let it go at that. And
I think that's a great statement, and I think that that the governor put it in the budget. We passed the bill. He didn't sign the bill. He let it become law. But some of the things that he wanted were this, and the House is taking the lead on the use of force bill, and we'll see when we get one. But if that holds it up, then that's fine. We have the monies to put aside, and it can be carried forward.
All right. But this bill is not where we're going to relitigate.
If there's a difference, maybe the speaker and pro tem can work it out.
Yeah. Okay. So I think that pretty much wraps up. I see we have Secretary Smith. He's out of the basement now. Or maybe you still have been relegated to the basement.
Actually, I am out of the basement, but today I'm in the basement because of the weather. So.
Oh, and they're not still delivering you food down there, shoving it under the door?
No, I'm fine. I can go upstairs. I can do whatever I want now.
Last time we talked to the secretary, they were pushing the food underneath the door.
I know, it's sort of reminiscent of being in jail.
It is.
But maybe the cuisine is a little better.
It was.
So I think we've kind of finished up on the budget adjustment. And if we can then switch gears, we will go to the Human Services section of the big bill. And you have Sarah Clark with you, and
it's just myself and Sarah Clark.
Well, you know what? With Sarah, you don't need anybody else. How's that?
Madam Chair, I was going to say that you know, a good executive will know when they have somebody that's really good that can bail them out all the time. And the CFO here, Sarah Clark, yeah, will bail me out in many of the cases. And what I'll do, if it's okay with you, Madam Chair, I'll sort of give it an overview, and then Sarah Clark, our CFO, will go into a high level of each individual budget like we normally do, if that's okay.
Sure. Uh-huh.
So for the record, my name is Mike Smith. I am the Secretary of the Human Services. I I almost said administration, and that's like years ago, but Secretary of Human Services. I want to go, and Sarah, if you're driving, I want to just go to right to the meat of it. This reflects an increase of $42.5 million of general fund, 4.3% over the FY 21 as passed. But I do want to point out that most of that increase is driven by backfilling the one-times we used in FY 21 budget. I wanted to put in some sort of smart remark on body cams that the secretary is going to be using body cams, but that's not the case. But we do have a provision for body cams in here, and I'll get to it in a minute. One of those examples of backfilling one times in 21 was the FMAP bump in the 21 base that we had to fill. If Sarah, if you could go to the next one, this is I'm going to move through these quite quickly because you're all familiar with this. This is obviously a large agency. $1 billion in general fund. When you combine it with the federal funds and other funds, it's a $2.6 billion enterprise. I don't have to explain that. The general fund, the GF, the GC, the global commitment, sits in the secretary's office with the general fund, and then it's distributed to all the agencies, all the departments when it moves into all funds and is matched.
Mm-hmm.
If we could go to the next one again, 3,542 positions. The biggest of which is DOC at 1,048, next in DCF at 960, Health at 547, and then Dale, DMH, and DEVA are between 250 and 375. As you can see, the Secretary's office is 61 positions, primarily made up of several entities, Sarah Clark shop in finance, Ena Backus's shop dealing with healthcare reform, and I'll talk about that in a little bit. And then, the field services division and some other operations within the secretary's office. Sarah, if you could, we'll go just briefly through these slides. The one thing I just wanted to show you is that the budget is, whether it's general fund, whether it's all funds, or whether it's Medicaid spending, everything has remained relatively flat through the years. You can see in all funds as well, relatively flat. And then if you go to Medicaid spending, again, relatively flat. To get to the highlights before Sarah gets into some of the specifics department by department, where we are investing in this budget about $3 million of new funds into DCF for early care and learning. It will be directed at the CCC FAP, the subsidy program in DCF's budget. As you know, we've spent a lot of money in early care and learning during the pandemic. One, to keep the operation of the childcare system viable during the pandemic by spending a lot of money propping it up. and making sure that there was a childcare system once we came out of that initial phase of stay home, stay safe. And when we came out, we did have a childcare system, and we did, through help with the legislature, provide additional funding to the tune of about $42 million, I think, all said and done when we got done. But there's more in federal funding coming in, about $12 million in this area. We're also investing $2.4 million in the DCF for Emergency Housing Initiative. As you know, we have virtually ended homelessness. I won't say we have ended it, but we have virtually ended it. But it's been very expensive. We thought at the beginning of the pandemic, the worst thing we could do is have people that were homeless and susceptible to the virus at the same time. So we increased almost tenfold our spending on the hotel motel program. I think I said this in the budget adjustment. That is unsustainable. And what we would like to do is get back to, and DCF can talk about this a little bit more, get back to our original plan of emergency housing, which was to decentralize this, get it to the local, at the local level where they can make local decisions and make local investments to really house homelessness, the homeless in there. One of the things that the governor and the legislature have done, as well as in the governor's budget globally, is more investment in permanent housing. That may help us eliminate family homelessness, and that's our goal in this. But we're on a path right now that we can't sustain with the hotel motel. We have over 2,000 people in hotel or motels right now, and that can't be. And we feed them as well, and that can't be sustainable over a long run. We're investing $495,000 in Raise the Age justice involved youth housing. As you remember, the legislature did expand the age that you're in the juvenile system. We need some more money to make sure there's housing for those individuals. $600K for the DMH Mobile Response and Stabilization Services. This is something we wanted to get off the ground last year. The pandemic sort of interrupted it. We believe that if you can get to a situation quickly and stabilize somebody that's in a mental health crisis, you can have better outcomes as you move forward. We've seen the clinical data on this in other states. It seems to have an efficacy that is worth us investing in this, and it's something that we have in our budget. And then funding for justice reinvestment initiatives, $400,000 to DMH, for DOC for community behavioral health services, $300 for transitional housing, and $200 for domestic violence intervention programming. I just want to talk about this a little bit because I think the chair's heard me say this, but it was many, many years ago. We had a pilot program called the Incarcerated Women's Project back in 2005. That had a huge promise in terms of what it actually did. And what it did is some of the elements of what the Justice Reinvestment Initiative does is take a person that's coming out of our correctional facility and surround them with services from AHS. Justice reinvestment is something that sort of mirrors that, and I'm very interested in doing that, because what we saw with the women's population in 2005 is that if we could surround them with services, their chances of succeeding were greatly improved. If we didn't, what happened was they ended up back in our system. So I'm happy with that. We're investing in this. We do have some one-times It was interesting to hear your conversation before we started, but we do have 1 million in the general fund for DOC body cameras. We think this is important. We think this is important for not only sort of documenting what's going on in our prisons, but also sort of helping with the cultural change that we have talked about, or that Commissioner Baker has talked about. And then investing $4 million. This is the governor has a larger investment on weatherization. This would be for DCF. As you know, we have we have weatherizations programs through DCF, through the local agencies, and this would invest $4 million in general fund from there. That's sort of the highlights, and I'll stop in a minute just to give you an opportunity to ask some questions on the highlights. Sarah will get into each individual budget. Some of these, all of these will come up into the individual budgets, but I just wanted to sort of hit the highlights at the agency level. I did want to come back to the Secretary's office just briefly. It's not in this budget, but we did do some organizational changes in the Secretary's office. Ina Backus is our Director of Healthcare Reform. One of the things that we discovered as we started looking at the all-payer model is that in the Agency of Human Services, there were different parts of healthcare reform that were doing great things. We're moving in directions, but maybe not moving in a coordinated way. And so we've moved the Health Information Exchange, the Vermont Chronic Care Initiative, and the Blueprint into the Secretary's office under the Director of Healthcare Reform. We haven't done it in the budget. We'll do that probably next year. But we have organizationally moved that so that it reports to the Secretary's office, and we can move, I think, nimbly when we talk healthcare reform. So that's some of the things that are going on in this budget. I'll stop here, but the meat of it will be somebody that knows this budget inside and out and can go through sort of each individual budget for each department, and that's Sarah Clark.
Okay, I can't see the committee here. Questions for the Secretary?
Jane, this is Becca.
Yes, Becca.
Thank you. Thank you, Secretary. Just a quick question. I am not familiar with the DCF weatherization program. I'm wondering if you could just speak to that a little bit, as I'm new to the committee and I'm unfamiliar with it.
Yeah, Senator, DCF can get into it a little bit more, but they distribute money to local agencies so that housing, both, and I can't define housing, but housing can be weatherized for those that are low income.
Becca, this is a program that's been in place for a long time. It came in back when the LIHEAP program first was funded at the federal level. And
Okay.
People realized that helping weatherize homes had a beneficial impact on fuel use. And
Sure.
so there is actually a surcharge on heating fuels that fund this program. And so it's been,
Okay.
and
Okay.
it's usually administered by your local CAP agency. The only place that's different is the Northeast Kingdom that has a different organizational construct, but it's really, it's a very old program. It's what, 40 years old or something. So that's how it's funded. And then you can use part of your LIHEAP block grant for weatherization services. So there's oftentimes we're moving money between the two.
Got it. Okay, thank you.
Now, but there are other weatherization services out there or programs. And so, but this is the old the old, the original program that is designed to provide weatherization to the very low income Vermonters. So any other, Mike, I do have a question, and I'm surprised Senator Sears, I know he's got a lot on his mind, but he keeps raising the fact that underneath the COVID experience, Vermont is experiencing a real problem with opioid deaths and misuse. And I see on your highlights, you've got a little bit for mobile, but in terms of support for our mental health system, which most people don't think is in great shape, that's level funded. I wondered if there was discussion around, from that public health perspective, the where we are with our opioid problem. And we talk about the importance of mental health being a cornerstone, but it seems like they're getting asked to kind of, with level funding, as everybody says, then if salaries go up, you're really operating with less money. And needless to say that that delivery system has been in touch around your funding proposal. So I wondered if you could speak particularly what you're seeing on the opioid front and how that connects to your mental health decisions here.
Yeah, let me just talk about mental health and sort of the investments that we've made over the COVID, and then I'll move into the opioid issue as well, because I will say that we need to start paying more attention to this. I mean, obviously our focus has been somewhat diverted, but not completely. But you know, when we have spent in our mental health system enormous amounts of money, whether it's with the retreat, whether it's with those designated agencies, in terms of making sure that we have a mental health system that is sustainable during pretty tough times here. We've reached out on telehealth. We've also reached out on mental telehealth. We've also made sure that we had beds available for those mental health patients that may be COVID positive. I thought that was very important during our time. So, you know, we've spent millions in that regard. In terms of the opioid, we've started to turn our attention back to this. And one of the things that we've done is we've just filled the chief prevention officer, which is Monica Hutt. That causes me another problem, but that will start the focus on this. And also, there are some grants in here. There are some funds in here that do sort of coincide or are divided between ADAP and mental health. And I'll let Sarah explain that in a minute in terms of what's going on in that regard. But we've spent a lot of money in the mental health system in the last year. We do have to start to refocus on the opioid issue that we have in this state as well as other states. And we are starting to turn our attention to that.
Other questions of the secretary? Okay, yes, Senator Sears.
I'm sorry I got disturbed. Had to move away for a few minutes. I'm more and more concerned that we're putting money towards it, but I'm not sure how effective the money that we're putting is. I'm worried about the ability of our designated agencies. I'm worried about the ability of our local groups to actually deal with it. If somebody wanted to be in recovery in Bennington County, there is no recovery housing, for example. We're seeing around the state areas where different groups have tried to provide something that they see as what they think is what is needed, but it isn't what is really needed. And I'm hopeful that Monica, in her new position, will help to spearhead a renewed emphasis on, for lack of a better term, programs that have worked. For example, we've got programs for people in recovery that particularly geared towards folks coming out of correctional facilities, but unfortunately those programs say you can't be under medicated treatment like Suboxone or methadone. So, you know, providing that service in jail, and it's a good one, not without problems. And yet, so I think we really need to rethink our entire delivery system and how we're delivering it, and whether or not, in terms of substance abuse recovery, what is the best way to deal with this? Hopefully, replacing the person in charge of Monica will do a good job. I'm hopeful, but I just it worries me that we are putting a lot of money into it, but it doesn't seem to be making the dent that we hope. And it's all of us. It's on all of us. It's long before the Scott administration. Yet, you know, when I talk to people out in the field who are working for rescue squads and so forth, one of their biggest frustrations is they see the same persons over and over with overdose. And they provide them with Narcan, but they're back.
Yeah, I hear you, Senator, and I'm willing to work with the legislature on any ideas that
I think
move forward.
The first thing we need is an inventory of what we have and what we don't have, and based upon evidence-based programming that we know can work.
Mm-hmm.
We need to fill those slots and not listen to some of us who are advocates for some particular way of doing it.
Well, it's an issue that we've got to start paying attention to, because it's going to be there maybe after we all get our COVID vaccinations, and we can't vaccinate it away. So other questions of the secretary? Otherwise, we'll move into Sarah's more detailed presentation.
Sure.
Okay. All right. I don't see any other questions.
Great, sounds good. So I should be sharing my screen again. And just to orient you to the materials that you've received, in addition to this presentation that we'll review today, that does a very high-level snapshot of each department's changes in the FY22 budget, general fund impact. You've also received the detailed crosswalks, the ups and downs documents, which shows in more detail each of the changes that we are presenting to you, as well as a one-page general fund impact summary, front and back one page, that gives you kind of at a quick glance the changes impacting the entire Agency of Human Services in the FY22 budget. So with that, I'll turn to the presentation. This slide is highlighting some of the items that you're going to see across each of the departments. Of course, as per usual, you're going to see salary and fringe increases, as well as internal service fund increases. That's pretty standard fare. This year, in what is the final year, you're going to see the continued phase down of the global commitment investments in the areas of room and board, impacting the departments of mental health and children and families, as well as the continued phase down of the UVM physician training investment that's in the secretary's office. For those that are new to the committee, when the Agency of Human Services last renegotiated our Medicaid waiver with the federal government, they established some clear guardrails where Vermont could no longer spend Medicaid dollars on some kind of non-traditional Medicaid items to include room and board and UVM physician training. Fortunately, at that point in time, they gave us essentially 3 calendar years in which we could phase down our reliance on Medicaid to support those activities. And so this is the final year. The 22 budget will no longer have Medicaid funding supporting room and board and UVM physician training. It's important to understand these are not cuts to those programs. We backfilled with general fund. And this should be done. You won't see this in the 23 budget, though we are in the process of renegotiating our next waiver. So a lot more to come in that area over the next year. You're also going to see across the entire agency the backfilling of a variety of one-time funds that were used in the FY21 budget. If you recall from the 6.2% FMAP bump that the Secretary referenced earlier, that was used in the 21 restated budget, as well as coronavirus relief funds and some direct funding from federal health and human services. So now I'm going to talk in a little bit more detail about the changes in the FY22 budget related to the Secretary's office. To orient you to the slide, on the left-hand side, I list all of the upward pressures on the general fund, which for the Secretary's office is roughly $48.3 million in general fund. On the right-hand side of the slide, I detailed the downward pressures on the general fund, which is roughly $36 million. Now I'm going to walk you through what some of those items are. On the left-hand side, as we've already discussed, salary and fringe and internal service funds is creating a pressure in the Secretary's office budget. It's been accommodated. In addition, we are backfilling the use of the COVID FMAP bump that was built in the 21 budget. And it's essentially one-time funding that we can probably talk a little bit more about the nature of that funding, because though it's one time, it is still in effect for sure, at least through the June quarter of 2021. And the federal government has indicated that it is likely underneath the Biden administration to continue this FMAP bump potentially through December. There is also, as you saw in the budget adjustment, some general fund to support the additional pressure associated with the Children's Health Insurance Program, CHIP qualifying claims. There is a small amount of general fund to provide additional contract support as we negotiate our Medicaid waiver with the federal government.
Sarah, could I ask a question about that? I thought somebody was saying maybe we could get an extension and that would save all the negotiating cost and workload. Did I imagine that?
I think we've had we've been kind of planning for our next negotiation for at least a year. And I think we've had a few different iterations. At one point, the start of the pandemic, that was our plan, was to seek a, essentially a no change extension with the federal government.
Yeah, I think we put some language in the budget to
yes,
authorize that.
However, our strategy subsequently changed because the Trump administration informed us that as part of that no change extension, they were not going to hold us harmless from a budget neutrality perspective. Budget neutrality is the concept that basically sets the limit on our total Medicaid expenditures. And so if we were to pursue this no change extension, it was uncertain what sort of negative impact that could have on our overall Medicaid spending cap. And so a decision was made that if we're going to be impacted from the budget neutrality perspective, that we should proceed with a full negotiation. And that is what we are doing. So, that was the Trump administration. Biden administration has now been in power for, I guess a couple weeks now. There's certainly a lot of change happening every day. We see this in the various executive orders that are being issued. So there's still a lot unknown from a federal Centers for Medicare Medicaid Services perspective, but we are still moving forward with our approach of renegotiating our waiver. I'll proceed. unless you have further
Yeah.
questions.
No, I think, I don't see any, but it's hard, I can't see everybody on my screen. I can see Senator Starr's window, not Senator Starr. I can see Senator, oh, here comes Senator Starr. Senator Nitka and Senator Baruth, but I can't see anybody else. So if you have a question, just speak up, but
Great.
otherwise we'll go to the Downs.
Okay, that sounds good. So from the Downs perspective, the largest driver of that is our base FMAP changed from 21 to 22. And actually on a calendar year basis, and what this means basically that the federal government is giving us more dollars for our Medicaid program than they did the previous year. And so we're going from an FMAP in state fiscal year 21 of 54.39% to a federal share of 56% in FY22. This equates to more than $20 million of general fund savings.
Since that's based on our per capita income that moves up and down, then that's good news on Medicaid, but it's suggesting some income stagnation for the population.
Exactly correct, Senator Kitchell. A good thing for budgeting purposes, but not for the overall economy in Vermont.
Yeah.
So, in addition, as we saw in budget adjustment, we're saving general fund dollars because our new adult caseload and utilization is increasing for this population. We're able to leverage an enhanced FMAP with the federal government. And so as this goes up, we actually save general fund dollars because of that enhanced FMAP. You are hearing, I believe you have the health department later this afternoon, and so they will talk to you in more detail about this, but we are restarting the home visiting initiative that was originally in the 21 budget and then was paused because of the pandemic. The match that we're using from that program is actually funds that the legislature appropriated a few years ago, $7 million in tobacco funds for the CHINS working group. That working group, as this committee, I believe, is aware, has been working. And one of their recommendations is to increase home visiting. And so the match that's being used for home visiting, this expansion in the FY22 budget, is actually from that $7 million tobacco fund appropriation from years ago.
Yeah, the CHINS work group submitted a budget, and this was a point of contention because the other body had actually scooped some of that money to use for other purposes, and we were the whole thinking behind this is to see if we can do a better job of not bringing so many children into state custody.
Yep. We're also, the 211 contract the Agency of Human Services holds, it received a one-time infusion related to the pandemic for one-time services. So we're removing those one-time dollars. We're still continuing to work with 211. They're a critical partner. We're not reducing services. This was a one-time pandemic need. As well as there was $6 million in the 21 restated budget to provide a payment to Springfield Hospital as it worked to emerge from bankruptcy. We have issued that payment. They have emerged from bankruptcy, and so we're removing those dollars. They're not needed in the base. That's the Secretary's office at a high level. The rest of my slides go through really quickly. Each of the departments of AHS, I know you have them all scheduled over the next, several days. I'm happy to go through if that helps you to maybe orient you to the changes that are happening in the departments. If you have time. Okay. I think I'll just.
I don't know, questions or Senator Sears, are you there?
I'm here now.
Okay, are you all set, or are you there with Bev all by yourself?
Oh, right now it's okay. I'm all set. Thank
All
you.
right. Well, if you need to get off, please don't hesitate.
Thank you.
The main thing is to take care of Bev. So
Thank
do
you.
we want to get into the budget with Diva, or I'm sorry, Sarah, if you could restate what you asked me.
Yeah, so I have slides for each of the departments at a very high level, kind of the changes that you're going to see in their 22 budget, and I can maybe 15, 20 minutes remaining. I can roll through that really quickly if that is helpful for the committee.
Some Appropriations Committee schedule for today.
Committee, do you want to have Sarah go through on the high level, or do you want, this will be repeated again, right?
Yes.
By each of the people. I'm just thinking in light of, there might be a need to just take a break for committee members, and I'm sorry to do this to you, Sarah, but I really would like to make sure Senator Sears has a little bit of time to make sure
I'm
everything is
fine. I took all the time I needed. I'm fine, but thank you very much.
okay. Well, I just want to.
No, it's fine now.
Okay. All right. So committee, do you want to run through the high points? Okay.
Sure.
Yeah, we should run through.
May as well, we're rolling.
All right, we've got Sarah here, so we'll take advantage of her presence and get the sort of the framework for the more detailed discussion that's coming up.
Sounds great.
Yep.
So the Department of Vermont Health Access, there are $11 million in general fund increases, salary and fringe, internal service funds, as well as the Medicaid consensus forecast that was adopted by the Emergency Board in January. You're going to also see general fund to backfill the COVID FMAP bump. There are some minor vacancy savings adjustments, as well as we're restoring what were some one-time savings associated with the Medicaid management information system. It's a contract with Gainwell, formerly called DXC. We are backfilling with general fund for those one-time savings. On the downside, general fund downside, it's relatively minor, just some children's health insurance program, CHIP, and disproportionate share hospital, DISH, FMAP adjustments. It's resulting in some general fund savings. And that's DIVA.
That's pretty, considering the size of that budget.
That's little.
Yep.
Little.
VDH, you have them coming up later this afternoon, but I think what I'll say to you is also very minor changes, salary and fringe, internal service funds, backfilling of some coronavirus relief fund that was used in their FY21 base budget, as well as this continuation restart of the sustained home visiting program that we've already discussed. And then from a general fund savings perspective, their financial director, Paul Daly, can provide more detail on these, but there's a variety of personal service and operating expense adjustments. But again, a relatively straightforward budget for the Department of Health, as they're really still focused on pandemic response.
Sarah, this is Senator Ballant. Can you hear me?
Yep.
Can you scroll back up to the previous slide? Great. Just for we get a lot of folks who watch these committee hearings, and I know most of the folks on appropriations know what all these acronyms mean, but I wonder if for the folks who do watch it on YouTube, you could just go through quickly and just explain what some of these acronyms are so they can follow along.
Sure. Thanks for
Thank
that
you.
reminder, Senator Ballant. I do like FMAP, that like flows off my tongue so easily. That stands for Federal Medical Assistance Percentage. It is essentially shorthand for the federal state match rate from the Centers for Medicare and Medicaid Services. So for all of our Medicaid program. DXC is a name of a company. It used to be our Medicaid Management Information System. They've since either changed their name or they were purchased by a company called Gainwell. And then CHIP is the Children's Health Insurance Program, and DISH is Disproportionate Share Hospital. I think those are the acronyms.
Thank you.
Yeah,
Exactly.
As I go through, I'll be cognizant of it for the rest of
That's
the departments as
wonderful.
well.
It hit me because there were so many right in a row, and I thought if you just dropped in, you wouldn't have any idea what was going on. So thank you so much.
Of course. Yeah, it's hard because we're buried in the details sometimes, but we need to step back. So thank you. So I think VDH didn't have that same challenge. So I think I'll move from VDH to DMH. Department of Mental Health has roughly 2.9 million general fund increases composed of salary and fringe increases, internal service fund increases, as well as the annualization of the 12-hour shift construct at the Vermont Psychiatric Care Hospital. You probably recall some testimony from budget adjustment where we were asking for funds to continue doing that in state fiscal year 21. Now we're proposing to do it on an ongoing basis. It's important to understand this is something that has to be bargained. And so it's not a done deal yet, but it is what our plan is. There's also a small amount of funding related to a child and youth residential facility increase. There's the backfill of HHS CARES Act and coronavirus relief one-times. HHS stands for Health and Human Services. It's our federal agency. And the Vermont Psychiatric Care Hospital actually receives some direct support dollars from the Provider Relief Fund from the federal government to support the Vermont Psychiatric Care Hospital. We are annualizing the cost of the new level 1 beds that are being built at the Brattleboro Retreat. This will provide for annual funding to support those operations of those beds. There is a small amount of money for the VPCH, Vermont Psychiatric Care Hospital, electronic health record update. As we discussed previously, you're going to see the room and board investment phase down in the DMH budget. And the two initiatives, mobile response and justice reinvestment for the community behavioral health. And this is where Secretary Smith was mentioning earlier, these funds are actually going to be used not only for mental health supports, but also for substance use supports. Likely at some point when the program gets stood up, we'll be splitting the funds between DMH and ADAP, but for purposes of the budget, we've requesting an appropriation of $400,000 in the DMH budget. From a general fund downs perspective, there are literally $679 of general fund savings in the DMH budget. And it's just associated with some reduced operating expenses. That's DMH at a high level. The Department for Children and Families. There are roughly $17.4 million of general fund ups. That's comprised of salary and fringe, internal service funds, the backfill of the COVID FMAP bump, the federal medical assistance percentage bump. There's also the backfill of some other one-time dollars that were used in the 21 budget. There are some minor earnings and position adjustments that Commissioner Brown will speak to you in more detail when he is in to testify.
You know, Sarah, if you were to just control for the substitution of one time with general fund, what is the overall increase for the agency? It's got to be a very small percentage.
I want to do the math because the lion's share, like the first slide, like just the FMAP bump alone is 46.7 million.
Mm-hmm.
And so if you were to pull out the backfill of the one time, it's in the 50 million plus. But I can pull that accounting and provide that to the committee.
I guess what I'm really saying is if you compare just overall, forget about the overall spending, I guess maybe gross to gross.
Mm-hmm.
It seems like where your ups are going to be pretty much salary fringe and internal service and a few initiatives, but otherwise it seems like we're really talking about a level funded. If you just look at without the switching of the one times and general fund.
Yeah, there are some funds to support like the Medicaid consensus forecast increase, the statutory nursing home increase in Dale, the developmental services caseload. So there are some funds to support caseload increases, but I understand what you're saying.
Mm-hmm. Or asking, I don't,
Yeah.
I'm thinking that underneath all of this movement of replacement of, one times with general fund, if you look at just sort of the gross, there's not a whole lot of movement here.
There's not very many policy changes.
No.
I think, we've got the DCF slide up now. I think that is like a lot of the kind of more policy type discussions are in the Department for Children and Families. So for example, the Family First Prevention Services Act is something mandated by the federal government that DCF is in the process of implementing, that's creating a need for some general fund revenue to kind of backfill some lost revenue as a result of implementing that Family First Act. There's also funds which was in budget adjustment for some high acuity mental health placement capacity. This is an arrangement with Washington County Mental Health, and so we're annualizing the cost of that investment that was in budget adjustment. The room and board phase down. There's a small amount of money for general assistance, GA burials caseload, as well as the secretary's talked.
We're going to annualize that higher rate of demise of indigent Vermonters, I guess, huh?
Well, making sure we have the funds to support that program, but
Yeah.
we are, I think we talked a little bit about this when I was in for budget adjustment. There is a FEMA program. We're still trying to get more details about that, but regardless, I think this increase is $60,000, so that's pretty minor.
It's hardly a highlight.
Yeah. And the rest of the items are initiatives that we have discussed earlier today. From the reduction side in DCF, there is a proposal to eliminate a vacant position. If you recall, in the 21 budget, there was a transportation services restructuring that has occurred. Essentially, DCF went out to bid, and so they've consolidated how they're managing transportation across a few of their divisions. And so there was one-time funds to support that transition that's being removed from the budget. We are eliminating a small strategic planning contract in the Family Services, FSD, Family Services Division. And we'll be doing those services with in-house resources, some minor lease savings. In continuation of the budget adjustment, there's continued underutilization of the Child Care Financial Assistance Program, CCFAP. And so you're going to see those savings included in the FY22 budget, as well as Reach Up caseload savings, which you also saw in budget adjustment. We are continuing to project those caseload savings into fiscal year 22. And then there's some minor general fund savings related to efficiencies within the Reach Up transportation program, working with DEVA, as well as leveraging Medicaid for kids' residential placements.
Senator Sears has his hand.
My question maybe is for DMH as well as DCF, and these, the room and board investment phase down in the residential programs, that those room and board payments to the programs are still PNMI regulated. Is that correct? Or
I want to get back to you on the answer to that, Senator Sears. I think that is the case for DMH, but I don't know if it is for DCF.
I'd be interested to know, because I do worry that if they're asked to cut, I think the federal government was wrong in this move, but if they're asked to cut room and board costs, it's hard to do.
Well, I want to be clear that we're actually not cutting room and board costs. We're just not using Medicaid
Yeah,
to
but
pay
how
for
are
it
we?
anymore.
How is it allocated? That's my question, I guess. Is it through the PNMI process, which is, as much as I hated it, it at least was uniform.
Or maybe they still use the PNMI, but then they have to just exclude those expenditures and what is Medicaid matchable. I don't know.
Yeah, I'd hate to see them using 50% fat hamburger instead of 75% or 85%. Those types of decisions.
Do you want Sarah to follow up on that, or are you going to?
Yeah, or well, because it's both DCF and mental health, I would like, yeah, I think it would probably be Sarah.
Oh, well, not only that, rate setting is in,
DEVA, yeah.
rate setting is DEVA, so we can, they're coming in next.
Cuts across all three.
Yeah, but the rate setting function is now in DEVA for all the entities, so I know you love rate setting. I'm sorry I
I
had to
do,
bring
I
it
mean,
up.
well, just for those new members, they were the people that cut my salary regularly.
So whenever we mention rate setting, we always anticipate some kind of response from our colleague. It brings back trauma.
Before I retired. they were cut
Uh-huh.
on a
Okay,
regular basis.
we're into Dale.
Yep, we're into Dale. So salary and fringe and internal service fund increases. You're also going to see the backfilling of a small amount of coronavirus relief fund that was used in the 21 budget to support adult days. There are funds to support the ASME collective bargaining agreement. This is also an item that you saw in budget adjustment, and this is the annualization of that. There is an increase for traumatic brain injury utilization that we are projecting, as well as the statutorily required nursing home inflationary increase and the nurse rebase for nursing homes. And there are funds to support, as I indicated earlier, home and community-based caseload increases, as well as the developmental services caseload. From a general fund savings perspective in the Dale budget, there are two areas: nursing home bed day utilization. You probably aren't surprised to learn that we are continuing to project savings because bed days are just not being utilized. And we are anticipating there to be carry forward available in state fiscal year 21 in the Choices for Care program that we're proposing to use to pay for the nurse rebase in nursing homes. Department of Corrections, the last department, the Agency of Human Services, there are $6 million in general fund increases, salary and fringe, internal service funds, as well as some minor operating increases. You're also going to see the backfill of coronavirus relief funds that were used in the FY21 budget. If you recall, that corrections was an area where we provided coronavirus relief funds to cover the correctional officer's salary, substantially dedicated to pandemic response. And there is the initiative that we've discussed related to body cameras and the justice reinvestment initiatives. From a savings perspective, from the general fund, we are proposing to shift the Community High School of Vermont, CHSVT funding to the education fund from the general fund.
Oh my goodness. What a novel proposal.
Yes.
And how much is that? And we know that we're going to have to fill that because the House will never agree.
Yes, it's more than 3 million.
Yeah. Mhm.
Yeah. And there's some minor operating expense savings, as well as $500,000 of additional savings from their new health services contract.
I move we agree with the governor on the Community High School of Vermont funding.
We're all in agreement, but
If we do it now, we've done it before, they can't say they didn't know we'd oppose them.
we'll keep that in mind, huh?
I just, I just want to make sure anybody listening in understands this. For years, we've been agreeing with the governor on this particular effort. And part of the reason is that these are young offenders, by and large, who did not graduate from high school and would have otherwise been in the high school. At one time, the largest high school in the state of Vermont was the Community High School of Vermont, which was through the prison system. It seems to us, at least on the Senate side, and evidently the governor's office, that this should be a education fund expenditure. If they were not incarcerated, they would probably be required to be in school.
Senator Sears, I'm having a hard time hearing you. Are you?
Oh, I'm sorry. Yeah, no, I wasn't speaking up. I just think that it's a longstanding issue where the Senate and the governor's office have been agreement, but whatever reasons, the House feels that it's taking money out of the education fund, but it really isn't. These are Vermonters who did not obtain a high school degree for whatever reason, and they would have a right, if they're under 21, to go back to high school if they weren't incarcerated. And it's a good school. Many of us have met people that graduated from high school through the community high school of Vermont and moved on with their lives.
It is, it's accredited. It's the same accreditation standards that some of our semi-private high schools like the Academy or Linden Institute have to meet. And I mean, I guess we feel from an equity, if you look at the statute in terms of youth and their entitlement, if they haven't completed high school, that to artificially say this entitlement gets funded in a different way by virtue of your being incarcerated is, it's hard to understand when the purpose of our education system is to get those kids and make that investment in the same way we would if they in fact hadn't ended up in prison. So it's nice that you're bringing that up again so we can relitigate that one. Thank you. So
It shouldn't be an issue for conference. They should just agree with us.
Well, if you're gonna, we should all have the same chance at life.
Yeah.
So with that statement, I'm going to suggest we take a break between 3 and 3:30, and then we'll come back. And I believe that it's Diva coming in at 3:30. Is that right, Chrissy?
You have the Department of Health.
Oh, Department of Health, sorry.
Correct.
Oh, thank goodness. All right, Department of Health. And then that'll be, I think, the end for today. So we'll take a break and see you all at 3:30.